Anyways, I wanted to say a little bit about goal setting from kind of a practical, clinical type of setting. It's important to do goals. And I really like the way Judith Beck talks about goal setting, and even making it a piece of the homework that you would do with a client. Gives a client time to think about what they want to get out of their treatment. Goals provide focus to what you're doing. If you don't have clear goals, then the treatment tends to go all over the map. Now, in some models of treatment, that's okay. From a CBT perspective, though, we're trying to keep our therapy to a time limit. We want to see the client make gains and be successful. And we can't do that unless we know which way we're going. And we'll never know if we get there if we don't have some clarity about the goals themselves. Now, there is kind of these SMART goals using the acronym SMART. The goals should be simple, they should be measurable, they should be attainable, they should be realistic, and they should be able to fit within a certain time frame. So all of those things are important. Now, I don't think you have to be that systematic with a client every time you talk about goals. Sometimes it's useful to use these acronyms or these goal-setting processes when you can see that your client has trouble setting a goal and being realistic about those goals. And so you can kind of go through a more systematic process of goal setting if that's a skill that you think will help the client towards where you're going in your treatment. But generally, a fairly general discussion about goals is sufficient, and giving them time to think about it, come back, reflect on it, and having sort of clarity to it. I think it's just really important that the goals be pretty concrete. Better if they're behaviorally described, and you can sort of systematically work at them and know when you get there. Sometimes in therapy we've tended to lean towards personal growth kinds of goals. Goals where we say, I want to improve my self-esteem, or I want to be a fully functioning person, I want to be more emotionally in touch with my feelings, or I want to self-actualize all my potential as a human being. Those are great lifelong goals. Maybe if the counselor is functioning in a role of a life coach, that may be useful. But in most of our systems where taxpayers are paying you to do work, they want you to have some efficiency to what you're doing. And so goals give you clarity about what you're doing, and it helps you have a time limit to the work that you're doing. Another thing that I've seen that I think is important in goal setting is it helps us set priorities about what tasks we are going to spend our time and our energy on. Sometimes when clinicians do an assessment, or a program does an assessment, they identify a whole range of problems. And so, for example, you come up with a list of 10 key problems that an individual has. The assumption then becomes that's what we're going to work on. We're going to work on all of those 10 things. But once you commit yourself to that, you've committed yourself to a fairly difficult process in terms of time and what you're hoping to accomplish. So asking the client about what they want to accomplish can significantly narrow down that list. And you, rather than sort of tackling goals that may not be that important to the client or may not be their first priority, you save yourself a lot of work. And you allow yourself to work with the client around something that's really important to them. So I think goals can't be underestimated in terms of their value and the importance that they place on keeping your therapy on track right from the beginning on to the end.